My name is Dr. McLigeyo. I'm a consultant physician and medical oncologist. That is the program that I did. I did a training in medical oncology under the Merck Foundation Cancer Access Program. So the course content was very good. This was a program that we did in person and not online at the Kenyatta National Hospital in conjunction with the University of Nairobi. And we had an in-person learning where lecturers actually came and taught the students that were in the medical oncology program. The content was very well developed and included both didactic lectures as well as practical sessions, because there was already a medical oncology ward. And so we had both the didactic and the practical classes. It was a very comprehensive content that also included the American Society of Clinical Oncology program, and also doing that exam, which all of us did. Faculty was both local, including lecturers that are based in the different cancer centers in Kenya, but we also had lecturers coming from the US and as well as from Europe. So it was quite a good program, and we are just happy that we went through it because it was quite well organized and structured. So before the course, I was a practicing consultant physician, but I was also attached to the medical oncology ward at the Kenyatta National Hospital. However, I had not gotten the skills and the knowledge around oncology. I was more or less learning on the job. But during the 2-year training, I managed to gain knowledge as well as practical skills just from both the classes and also the management of patients that we had to do during our training. And therefore my skills and knowledge was really increased during that 2-year training program, and I am a better doctor and oncologist because of that. In terms of my patients, as I said initially, I was actually working in the medical oncology ward as a volunteer, but without the skills and the knowledge. And so right now I'm able to actually assess, evaluate my patients using the skills and the knowledge learned during my training. And this has benefited my patients because now they're getting specialist care from someone who's trained, and they're not able to get that prior to the program. So some of the achievements that I can mention that has come as a result of joining the Merck Foundation Cancer Access Program was, one, during my training, there was another online program that was being offered to students who were in their home countries with the access to patients, which was perfect because I had access to patients and a training within. So I was able to also combine it with an MSc in clinical oncology at University in Germany. And because it was more online, they preferred that. There was already another program in country that was giving us the practical aspects of it. And also because of that, I was able to do the European Society of Medical Oncology training program, and also do the exam and be certified. And also that exam, you can only do it if you're already in another program. So it gave me that opportunity. And so those are additional skills and knowledge that I gained due to being in this program. Along with that, when I completed my training, I was employed as a lecturer at the Kenyatta University, and I'm basically teaching what I learned during my course, which is hematology, hemato-oncology, as well as treatment of solid tumors to undergraduate students. So that is an achievement that I wouldn't have been able to do without this training. I currently work and actually initiated the cancer clinic at the Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu, which I still run, that initially had not started, and currently we are seeing about 3,000 patients or 3,000 patient visits per year. For my patients, as I said, in Kisumu in the other 4 counties that are in that region, there was no oncologist when I went there in 2019. And patients really had to travel from Nyanza and western part of the country and come to Nairobi for treatment. And I think a lot of those patients right now, we are able to see them locally and save them the inconvenience of being in a different town and receiving treatment in a different town. So patients have also really benefited from the services that we are offering in Kisumu. So it's a course that I would refer my colleagues at work and also the younger physicians who are in training and who have completed their training, because it was easy. You do it on site and within your country, and it is relevant. We have a lot of cancer cases that are developing in our country, and we need more oncologists. And along with that, it was quite well planned and structured, and all the relevant content that one needs is available in Kenya. So I would like to thank the Merck Foundation Cancer Access Program for giving me the opportunity to train within my country as a medical oncologist and also as a hemato-oncologist. Without Merck Foundation, it would have been much harder to gain the skills and the knowledge that I gained without their support. I would also like to thank the CEO of the foundation, Dr. Senator Rasha Kelej, for considering us for this training opportunity and for all the support that she has given us as doctors in Kenya to increase our knowledge and skills in different aspects of specialties. Thank you very much, Merck Foundation Cancer Access Program.